with you. Sorry, just a minute. The last time that we talked with you, the numbers in Sacramento County were going in the right direction. We had just gotten into the orange tier, and the county had opened up, and the state had opened up. And so things were looking good. We were continuing with our vaccinations, but unfortunately, here comes Delta. The Delta variant has been creeping up. The numbers have been creeping up. And if you've been watching the news or following what we've been saying in the media, this Delta variant is very contagious. And we have seen, as a result of that, an increase in cases. So the update from this morning, from our dashboard, the total number of cases of COVID are 112,501. Today we added 357 cases. This is just a one-day addition. So when you look over the whole week, we've been adding about 240 to 250 cases per day. And our case rate, which is comparing it to our population, has been going up by 1 every single day. And so last week we started off at 8. We are now at 15. So it's has been going up pretty rapidly. The deaths are still not increasing a lot. It's about 1,766, but we know that there's usually a lag before you start seeing an increase in deaths. We are seeing an increase in hospitalizations as well. And in talking with the state representatives, one of the things that they have pointed out is that now we are seeing younger and younger people being hospitalized. Our average age of hospitalized cases was in the 60s, and now that has dropped to the 50s. So that is probably due to the fact that this Delta variant, it seems to be more severe even with the younger population. And the other also is that we are not seeing a lot of cases in the long-term care facilities where we usually have the older people. In previous outbreaks, previous surges, we were seeing an increase in outbreaks in the long-term care facilities, but this has not happened this time. And we think that a major reason for that is that the long-term care facilities were the first ones to get the vaccine. Their vaccination rates are 80 to 90%, or many of them actually at 100% for the residents. And that has helped to protect that population. But we are seeing some breakthrough, what we call breakthrough cases. That is cases among people that are vaccinated, because we are seeing an increase in circulation of the virus within the community, especially in communities that have low vaccination rates. But to point out again, the vaccine is effective. People that are vaccinated, even if they do get the virus, they tend to get less severe disease, and their chances of death and hospitalizations are much less. And when you look at our cases, the majority of the cases that we have are among unvaccinated. So speaking of vaccination, our vaccination rate, when you look at the entire population, is at about 48% fully vaccinated. And then if you look at only the population that's eligible for vaccination, which is 12 years and up, it's about 56. So we still have a ways to go to get to our goal of 70%. When you look by geographic area, you see that some areas are doing well. They have already hit that goal, but we still have some areas, as I mentioned, especially in underserved communities, where the vaccination rates are low, in the 30s. Lastly, just to mention a few things about masking, because of the concerning trends that we were seeing in the cases, Sacramento County did issue a strong recommendation that everybody mask when they are in indoor settings in the public where vaccination verification is not possible. So places like grocery stores. And again, the reason for that is that when you have a high level of virus circulating in the community, it increases the risk for everybody. The state still has a masking mandate, which requires that anybody who is not vaccinated should be masking indoors and in certain settings, which includes schools, jail, healthcare settings, and public transportation. Recently, the state, as well as the American Academy of Pediatrics, released guidance for school reopening. And this calls for having all children in person in school. And because a large percentage of children are not eligible for vaccination yet, they also call for continuing masking in indoor settings in the schools. So with that, I will turn it over to Dr. Cohen.
Thanks, Dr. Kasirye. Hi, everybody. My name is Stuart Cohen. I'm one of the infectious disease docs at UC Davis. And I've been pleased to be on these sessions for a while now. And things have definitely changed. I think just echoing what Dr. Kasirye brought out, the number of people who are presently in the hospital now at UC Davis compared to 2 weeks ago is somewhere between 2 and 3 times the number. We also are seeing about a third of those patients being in the ICUs, and almost all of the hospitalized patients have not been vaccinated. So that is the message. The people who are being hospitalized are the people who have not been vaccinated. And without knowing all the exact numbers, we do have younger people that we wouldn't have thought of on ventilators or on what we call ECMO, which is sort of like doing a bypass on people so that their blood gets oxygenated outside of their body while they let the lungs recover. So we didn't see this at the beginning, right? The people who were in those circumstances were the older folks. So that's definitely different. The other thing is we don't do a lot of strain identification, but we have done some looking for the different variants. And several days ago, I saw data for that particular day where about 79% of the positives were Delta. So that is what's circulating. I think, the CDC mentioned that it was 83% of the new cases in the United States, at least at UCD. I think it's very similar to that. And I'm certain that throughout California, it's the same. And it does appear that this is much more transmissible. So we've also seen an increase in the number of our employees who have been infected. Most of them are infected in family or other community settings. We haven't been able to trace anybody to a hospital-associated transmission. About half of those people who are infected are vaccinated. And so I think that's an important thing too, to reemphasize that I don't think anyone expected necessarily that vaccines would absolutely prevent infection. What we knew is that it would prevent serious disease. And none of our healthcare workers who have been vaccinated have had even what I would define as moderate disease. They all lose their sense of smell, they lose their sense of taste, they have low-grade fevers, and they have a cough with minimal shortness of breath. And we really haven't seen progression. We haven't gone through the data on these vaccinated people to see whether these healthcare workers or even the vaccinated people who we may have had over the course of the last couple of months in the hospital are people who have immune problems where they might not have developed a good response to the vaccine because of the immune problems. And so I think that's sort of where we're at right now. We never really stopped masking in patient care settings, but we're going to start masking again. As of yesterday, we started masking again in like office settings when more than one person is in there, even with vaccinated people, because one of the other things that we have noticed, which probably accounts for some of the transmissibility of the Delta variant, is that there's an awful lot of virus in people's noses when they are infected with the Delta variant. And that includes people who've been vaccinated, even if they don't have symptoms. And so that makes it more transmissible. And, you know, we look at ourselves and maybe with some slightly inflated egos, but we look at ourselves and we think, you know, we're a small group. We can't afford to have a bunch of people out because they get infected. And so we have to be really cautious, not worrying that we are likely to get really sick, but really being cautious because we want to be able to be around to be able to provide the care that the patients who need it can get. So I'll stop talking at this point too, and I look forward to answering the questions.
All right, thank you both for those introductions. So we'll get started with some Q&A. I'll just kind of start at the top and let's see where we go from here. So this person asks, shouldn't all children under 12 be masking indoors at places like grocery stores or other large public events like a Sacramento Republic soccer game?
If it's an outdoor setting, then they don't have to, but indoors they do have to.
All right, with these increases, obviously a lot of interest in the vaccine. This person says, I'm 75 years old and I want to know where I can go to get the Moderna vaccination.
We do have that information on our website. I don't know, Nick, if you're able to pull that up. They can also call 211. That's an easy number to remember. And they can get information on available clinics within the area. We have a lot of pop-up clinics that we're putting out in communities. And we also have places like pharmacies that carry the vaccine as well.
Yeah, you know, the situation now, just as a comment, right at the beginning, there wasn't enough vaccine to go around. Now there's plenty of vaccine. And so for people who are really interested, there are probably places that are very close to where you live that allow you to get vaccinated without having to run around town or get put on a wait list or all the things that people were doing at the beginning to get vaccinated. So I think that's a real positive.
And this is a follow-up from that same person asking, after I get my Moderna vaccination, will I have any problems?
Well, I don't think so. So let's just remind people that most of the side effects that have occurred with the Moderna or the Pfizer vaccine have been related to sore arm or some fever or flu-like symptoms for a day or two after they get vaccinated. And with the Moderna vaccine in particular, it seems like maybe 4 or 5 days later, there's a percentage of people who get a rash located at the site of where they got injected, or maybe elsewhere that probably is associated with the immune response. But the vaccine is 94% effective. The antibodies last for at least 6 months without significant decline. I suspect we're going to start seeing data out to a year since the clinical trial sort of ended just about this time last year. And so we will be seeing more information. So yeah, I think it's a terrific vaccine. I think that you will do very well with the vaccine.
All right, next, we have a question about the current hospital situation in Sacramento. This person also states they noticed that the website no longer shows the number of regular beds in use or available beds.
The information that we put on our dashboard about hospitalizations comes from a polling that the state does. So if they are not providing us with that information, that's the reason why it's not listed, but I will look into that. But otherwise, yes, when we first started seeing an increase in cases, the hospitalizations were remaining steady, but now we have seen a huge jump. And as Dr. Cohen pointed out, it's 2 to 3 times the number of cases that we had just a few weeks ago.
One thing I would say about the hospital beds too, I can't speak to what the county puts on their dashboard, but generally this time of year, hospitals are not quite as busy as they are in the peak of the winter as far as number of patients, because primarily because of respiratory illnesses, hospitals have always sort of cycled, and the summertime is a little bit lighter. So I think the bed scramble, at least for right now, doesn't seem to be as big of an issue as it was in January or February. But that's something that bears watching because that may end up becoming a potential problem.
All right. Here's one. Is there a booster vaccine for Johnson & Johnson? And maybe more widely, we talk a little bit about boosters in general.
Yeah, so there isn't right now. The committee for immunization practice that is part of the CDC had a meeting today, and part of the meeting was discussion of booster doses of vaccine, particularly for immunosuppressed patients. And they reviewed the literature, which I think many people, at least many of the transplant patients that I work with, are quite well aware of already, that demonstrate that after 2 doses of the RNA vaccines or 1 dose of the J&J, they don't always have a good antibody response. And there has been an attempt to try to boost that by giving another dose of vaccine. At this point, CDC is not recommending the use of a booster vaccine there actually is some information in Europe where I think they're taking at least the most highly immunosuppressed people in Great Britain and considering giving a booster vaccine. There are safety data now that show that you can, at least in small numbers of people, it's been safe to mix different brands and different types of vaccine. So the AstraZeneca vaccine, which was never approved here in the United States, is more closely related to the J&J vaccine, and that's been given after the Pfizer vaccine or vice versa, and people have done fine with that. So, so I think the data have to be fleshed out a little bit. I don't think anyone's rushing to start giving people booster vaccines. When it does roll out, and assuming there will be a point probably in the relatively near future where they will say it's time to start giving boosters, the first groups will be bone marrow transplant patients, oncology patients with hematologic malignancies like leukemia or lymphoma or myeloma, and then patients with solid organ transplants. Even older guys like me are not going to be first in line.
All right, so we have a question about the infection rate of children, specifically age group 5 to 11. And as a follow-up, well, let's start with that and then we'll go to the follow-up. Do we have any
I don't have that information. Do you, Dr. Kasirye?
I don't either. I know that there have been some situations with outbreaks in daycare centers, and we have had outbreaks in schools, but I don't have any numbers to provide.
I'll share, there is some demographic data, which includes distribution by age on our dashboard. So I'll go ahead and put that link in the chat so folks can check that out. As a follow-up question, they also asked, how much does the data show infection is reduced by properly wearing a mask? Do we have any data on mask effectiveness?
Yeah, so there were data at the beginning of the pandemic that demonstrated decreased, at least measurable virus when people are masked. And there have been a number of studies. Some of them have had questionable methodology, but by and large, when you're wearing a mask, and if you're the one that's infected, the amount of virus that gets out through the mask and potentially can be transmitted to somebody else goes down significantly. And likewise, if you're wearing a mask, it will take out some of the virus. Since we are typically not walking around with fully fitted N95 masks, we don't have a total barrier. What we're doing is lowering the amount of virus that our mucous membranes would see, and therefore decreasing the risk of infection. So both people being masked significantly lowers the infection rate because of that very fact, but it doesn't totally abrogate that risk. I think that's the other point, is that it is still possible to get infected even when you've been masking.
For our viewers who are fully vaccinated, should they still be getting tested for COVID-19?
Yep. Go ahead.
I was just going to say that I think what we have advised so far is that if you are exposed, well, definitely if you're exhibiting symptoms, you should get tested. And then also if you are exposed it is advisable that you do that. And that's about it. I don't know, Dr. Cohen,
Yeah.
what you have at the hospital.
Yeah, regarding testing, so we have never had a very robust program either at UCD or in Sacramento County, and I mean UC Davis Medical Center, for doing a lot of asymptomatic testing like they have at UCD in Davis and the city of Davis. We are going to require in our healthcare workers that they be tested at least once a week if they're not vaccinated. And we will offer that asymptomatic testing to anybody who's vaccinated, regardless of whether they're exposed or not. I think that since we really don't know how many people who are vaccinated get infected that totally don't have symptoms, because we're not really doing that testing, and we don't know whether vaccinated people who actually get infected can transmit to another vaccinated person. I think there is a lot of information to be gained. And if there was an easy way for people to get tested without having to buy kits at home and do all this other stuff that costs money, I think it would be very helpful and very interesting from both a public health perspective and then for the individual person. But right now, so I think there is potentially a benefit for asymptomatic testing for vaccinated people. Obviously, if somebody has symptoms, I agree that they have to be tested, right? I mean, that's a given.
Right. So given the events of the last few weeks and some of the recommendations and requirements that have been coming out, we've had a lot of interest in masks. This person asks, if masks aren't going to be required indoors, why are we not still physical distancing?
In many of the settings, if you require physical distancing, it means that you are going to have to reduce either the capacity, close certain businesses, such as, and that's just one of the discussions that was in play in making decisions about the what's going to happen with the children when they get back to school. Because with the social distancing or physical distancing that was in place in the past year, the schools did have to reduce the number of children that could attend school. And so this year, there's been a focus on seeing how we can get all children back in school in person. And so that's why it's more important right now to make sure that people do use the masks appropriately. And again, and the other reason also that we have not included the social distancing in the recommendation that we put out is that we're still putting a focus on vaccination. We know that vaccinations are effective. If we are able to get the vaccination rates up, even in the communities where it is low right now, that will drive down infections and that will help us to get back on track. So that's where the focus is right now.
All right, and with apologies to anonymous attendee, I'm going to skip ahead a few questions just because Dr. Kasirye mentioned schools, and we had another question about that, so I think we'll stick with that theme for the moment. The question is, how can elementary schools safely reopen next month when children will not be vaccinated until sometime in winter?
It is a concern. And so definitely we are watching that very carefully. And that's why, again, we are requiring that, especially indoors, that all children, as well as the staff, of course, are masks, continue to wear masks. because that will help to reduce the infections.
And we have another question about masks here, and actually with regards to vaccination requirements. Will Sacramento follow other counties with strong vaccination requirements for employees working indoors or regular testing? And for regular testing, what frequency constitutes regular testing?
At this moment, we are not, I think there are only a few counties that may have made that requirement, but definitely we are watching to see what is going on and looking at the numbers and in conversation with other health officers as well as with the state in whether we need to take any stronger actions. As far as frequency of testing, that is actually still required in certain settings such as long-term care facilities, as well as healthcare facilities if their vaccination rate is below 70%. And that's, if they're using the antigen test, that's twice a week. And if it's the PCR, then once a week.
Yeah, I think, UC has a system-wide mandate for vaccination. There are religious exclusions. There are potentially medical exclusions, and their personal belief exclusions. So it's a mandate with ways to opt out, but those who opt out are going to have to test weekly. Again, we all use PCR, so we're doing weekly. I think on the main campus for the students, they're going to make it twice weekly, even though it is a PCR test. So I think this is part of the way to encourage people to get vaccinated. Is it's going to end up being a giant hassle to do this every week. And so, right, so you got to think about it. It becomes really tiresome after a while, even if it doesn't have to be a nasopharyngeal swab. You could do it with saliva or just with a swab in your nose. It's time consuming and you have to do it. And so get vaccinated.
Maybe they should just start using bigger swabs. Motivate folks, no? All right, so Stephanie has a fairly specific question about her workplace. She says, my employer has an essential workforce in warehouse setting, and we want to keep everyone safe. We do not mandate vaccines though. Will Sacramento County be publishing breakthrough infection data? Will this be useful for us so that we can anticipate and engage our medical team about safety protocols if breakthrough infection rates begin to spike?
I will take that back to our epidemiology team. I know that they have been watching that, but since the numbers have been low, I don't believe that we have it on a weekly basis on our dashboard, but we can certainly, I will take that information back and see.
I was just perusing our dashboard, and I think if you do go to the vaccination tab, there is a little bit of information there on the number of vaccine breakthrough cases, the patients with positive PCR result after full vaccination. It currently indicates 853, and of those who are symptomatic, which is the official definition of a breakthrough case, 294.
Right, but that's like total since we
Correct.
started vaccinating in January. We're not doing it week by week.
Right. Right, so we've talked a little bit about Delta, and we have now a question about Lambda. Is the Lambda variant in California?
Our dashboard does have information about the variants that have been identified here. I believe it is, but I can't tell you what the numbers are.
And I think, Dr. Cohen, you talked a little bit about Delta variant previously.
Yeah. Hey, can I just mention something about Lambda? I must have muted myself instead of unmuting myself. So I looked around earlier today when I was trying to get organized for this discussion, and most of the dashboards don't actually have Lambda. They have other variants, which account for about 10% of the variants around the United States, of which Lambda is lumped into. And so I don't know that anyone has exact numbers on that, at least not on CDC's website, which is pretty close to up to date with the variants and variants in different regions of the country and different states.
So from Lambda back to Delta, is the Delta variant considered more transmissible and more virulent?
Yeah, it appears that way. It's definitely more transmissible, as we've already said, but you know, we're seeing significant disease, and again, in younger people that weren't getting this sick with the prior variants. So I think that it is more virulent, and as well as more transmissible. And again, I think a lot of it has to do with the fact that the amount of virus in the body goes up much, much higher, and therefore is associated with more of an immune response, which then makes the disease more severe.
Okay, and this question, a little bit more on vaccination data, asking where can I go to find vaccination rates in my census tract, and what can I do to help increase them?
So the census tract data is not on our dashboard. We do have the vaccinations by zip code. I'll have to go back to the epidemiology team and find out if it's possible to provide that.
Right, another question about vaccination rates. This one's specific to where you two work, and me too as well. What percentage of employees for the County of Sacramento are fully vaccinated? And what percentage of employees for UC Davis are fully vaccinated? And will either of our organizations fire employees if they do not get fully vaccinated?
So I can start, and actually I forgot to answer the other part of the previous question, which is what can we do, or what can that person do to help? I think the most that you can do, one, is to make sure that you, your family, your friends, your social circle, that they're all vaccinated. That's a good place to start. And then definitely, if you can, interested in volunteering, being able to check on the our website and find out if there are any clinics within the area, and be able to contact us and see if there are additional opportunities for volunteering. And as far as the vaccination rates for the County of Sacramento, that information is kept by the personnel department. So even I do not have access to it. I only get access to information on an as needed basis when we are doing an investigation of somebody who is positive, or when we are investigating an outbreak. Right now, vaccination is still on a volunteer basis. I have not heard of any plans of making it mandatory. Dr. Cohen?
Yeah, so I'm not sure whether I'm allowed to share the information. I actually do know it. But we meet at very least, we meet the county's criteria of having more than 70% of our people vaccinated. And as I mentioned, UC has a mandate. The mandate is going to be to participate in the program, very similar to the mandates that we have with influenza. We don't make everyone get vaccinated, but they have to actively decline. And if they have a medical exemption, they're going to have to actually see somebody who can attest to their medical exemption. So we are trying to be rigorous with this. What if somebody doesn't follow the whole process? That's above my pay grade, folks. I have no idea. And that is a separate question. But I will point out that there are a lot of vaccines and immunity that we already require in health systems. So we want everybody to be immune to hepatitis B, and everyone gets vaccinated, and some people don't develop an immune response, but everyone gets vaccinated. They all participate. This started back at the beginning of the AIDS epidemic, where Cal OSHA came up with what we call bloodborne pathogen rules. Similarly, everybody, I got to UC Davis in '81. I had to be immune to rubella when I got to work. Now we require people to be immune to measles as well. And so there are a lot of things that have been required all along. This is really not that far out of what's standard, right? Our job is to take care of our patients. And so we don't want to contribute to their problems by infecting them. And so we really have to be very thoughtful as healthcare providers about the fact that we're not only protecting ourselves, we're protecting our patients, in addition to our families and our loved ones, but we're really protecting our patients. And that's where the mandates come in healthcare settings.
All right, our next question comes from Kathy. She asks, is there any plan for Sacramento County to reach out to the federal government to request help via federal strike teams to assist to get shots in arms? Haven't we been stagnant at 48% for a while? The White House COVID team update this morning stated that they'll also help with sequencing, funding, etc.
We are already receiving funding. We actually also have been working with the National Guard for a long time now. That is federal assistance. And we are also getting state assistance. There are teams that the state, contracts that the state has and sends out teams to different counties, and we have been using those. We also have a contract with another organization called Curative that is also doing vaccinations. And that is in addition to our own teams. The fact that our vaccination rate has remained stagnant for a while is because at the beginning, the vaccinations we were doing were at high throughput sites. And so we were doing like 1,000 vaccinations a day, 1,000 vaccinations a week. And so the numbers were going up pretty fast. But right now we are doing small pop-up clinics, 100 to 200 people per day. And it's not on like 5 days a week. It's these are pop-up clinics. So we might have one at one site and another place. And so we have a lot of pop-up clinics. I think we're doing about maybe 20 to 25 total within the county, but all of them are really small. So when you look at that, our numbers are going to go up really slowly. And then in addition, also because of the outreach that we are doing to get these individuals to the clinics, the assistance we're providing with transportation, with interpretation, and also answering questions. We have what we call vaccine ambassadors. These are lay people who from the community that are trained. They get additional training about how to talk about the vaccine, to be able to answer the questions correctly. And then they go out in the community, and sometimes they are going door to door. So you can imagine if you're going to go door to door, it's going to take you a long time to get through the entire neighborhood. So we are working, the numbers are going up slowly, but it's because the amount of work or the work that is required right now is a lot more labor intensive than at the beginning where we had the high throughput sites.
All right, and sticking with that theme, I'm going to jump ahead just a bit here. This other question is, what is the plan to encourage higher vaccination rates, since pop-up clinics, prize lotteries, state press don't seem to be really working?
What we have found that has been most effective is using what we call trusted messengers. So vaccine ambassadors are part of that. And then we also have contracts with several community-based agencies that provide services in the underserved communities. And so they are going out and talking to individuals and convincing them to get vaccinated. We're working with churches. Those are also considered trusted messengers. So I think that's right now that seems to be the most effective, but it is also labor intensive because it's one-on-one.
Yeah, I agree with that. You know, one other thing I may use as a shameless plug, but we are actually doing a trial that's funded through the National Institutes of Health in 18 to 29-year-olds who are vaccine hesitant, and enrolling them and allowing them to either get vaccinated immediately, delay and get vaccinated when they think they're ready, or even not get vaccinated. The trick here is that we're asking people to do nasal swabs daily for basically 4 months, $10 though per swab. And that we hope will, number one, get people a little bit motivated to participate, but then we also have an opportunity to talk to them regularly and try to get a sense of what the concerns are. I think one of my issues, and I understand that I am not necessarily what Dr. Kasirye would call a trusted messenger as a healthcare provider, but when I have patients that I've been taking care of for years, and when some of them don't want to get vaccinated, it's difficult to actually discern what their problem is, right? They don't give me a specific reason why they're not getting vaccinated. But I think that when you talk to them, after a while, right, I've had these people tell me, I finally got it, right? You know, they don't totally say I beat them down, but in a way it's sort of like that, right? Because after you talk to them a couple of times and you really start addressing sort of global issues, right? Because if they can't tell you specifically what the problem is, they just don't feel comfortable with it. That's a hard thing to answer. So I think that's the other thing, even with people like myself, having access, being able to talk to people. I did basically a clinic visit today with somebody who just had vaccine questions. Yeah, right. I set up a clinic slot so that I could talk to her about all the issues that that she raised. I think, you know, we have to be able to provide good information, which is why I love participating in these sessions. Um, but a lot of a lot of it has to be done over and over again for people who are really unenthusiastic. And right, as long as they're not talking about conspiracy theories, I think you have an opportunity to get people to ultimately realize it's to their benefit to get vaccinated.
I wanted to add to that. I know we usually use the term trusted messengers for lay people, but maybe for healthcare workers and doctors, we'll just call you respected messengers or something, because I did want to point out that I think the interaction with healthcare also is important. There's a survey that was done that showed that for a lot of people that were still hesitant, they preferred to get vaccinated at their doctor's office. And we also know from previous surveys that have been done about smoking cessation is that a lot of people, or also for people that were dealing with obesity, that for many of them, just being able to hear it from their doctor convinced them that this was serious. And about the conspiracy theories, I think it's also dependent on where they're coming from, because I recently had an experience where somebody that I knew called me and was genuinely concerned and asked about some of the conspiracy theories that were floating out about the, genetic engineering. So I just said, hey, okay, let's go back to Science 101, explained about the DNA, the RNA. And he said, you know what, I got it. I'm convinced I'm going to get it. So I'll check in and make sure that that person did. But it depends on where they're coming from. Some people come in and they're already closed off, and regardless of what you say, they're not ready to listen. But there are some people who have heard the conspiracy theories, but once you talk to them and once you tell them, look, there is no way that a vaccine shot can electrify you and make make you magnetic or something, and just say, look, let's talk about it, and it convinces them, or like a light bulb going off, and you're like, okay, please tell me, how did the electricity travel? And they're like, well, yeah, you're right. So it does depend. And like you said also, Dr. Cohen, sometimes it takes several times of talking before you can get through to people.
Yeah, I think, one of the biggest concerns that people have is the rapidity with which the vaccine rolled out. And we've talked about this before for those who have been on this call previously, right? These vaccines were being developed 15 years ago when COVID's parent virus first showed up in the early 2000s. And so this was a model that was just waiting for the right virus to be able to drop into. And I think that that is really an important concept because they didn't have to start from scratch. They already had basically they had a cassette that they could just drop in what they needed to drop in to get things rolling. And then I also you also again look at people focus a lot of times on breakthrough infections, but again, when you look at the breakthrough infections, the people are not being hospitalized. No one's on a ventilator. The number of people who have died with breakthrough infections is a minuscule percentage of the people who have been vaccinated, right? There are 130 million people vaccinated I think they're somewhere in the 500 range, if I remember correctly, of people who have been vaccinated and died, and pretty much all of those are people who are immunosuppressed. So I really think that this is an important thing. It's right. You want to be around for your families. You want to protect your families. We want to get done, right? We've been doing this for too darn long, man. I'm tired. This has been a year and a half already. You know, we got to get this behind us and move on.
Very good points. And actually, I wanted to add to what you said about the breakthrough infections, because our epidemiologists looked at the case rate among those that are vaccinated compared to those that are not vaccinated. And for those that are vaccinated, the case rate is 2 per 100,000. Among those that are not vaccinated, the last time we checked it was 12. It's probably 15 or over 15 right now. So you can see that definitely the vaccines do reduce the risks of infection, the severity of disease, hospitalizations, and deaths. I also wanted to point out again, you brought up a point about the rapidity of the rollout of the vaccine. And when people bring that up, I tell them that actually I look at it the other way, because when you compare what happened in 1918, where they went through 2 years of people dying and they had nothing that they could provide to them to help to slow down the surges. But within a year, we were able to get 3 vaccines, in fact 4 if you count the AstraZeneca, that are very effective. And so it's really helped to protect people. So I think it's fortunate that we were able to do it so quickly. If I was to take a choice, I'd rather I was born in 2020 instead of 1918.
Yep, I agree. By the way, there's a fifth one that also is highly effective, that eventually will get to the FDA. I'm not sure when, but so there are at least 5, and 3 of them have over 90% protection rates.
All right, so we have a question about how common is long COVID and MIS-C?
Yeah, so let me start with the second one, which I think is a little bit better quantitative. So MIS-C stands for multi-system inflammatory syndrome. The C stands for children. There's also a MIS-A for adults. And I think the numbers have probably still been under about 5,000 cases, at least reported to the CDC. So it happens. It's relatively uncommon. We've seen a couple adults with what we would define as MIS-A, and so it's there. It's not a huge number. On the other hand, long COVID, or what some people are now calling post-acute COVID syndrome, is really pretty common. And I think if you look at people who have been sick, probably at least half of them still have symptoms 6 months later. As far as the people who really are much more severely affected, that number is probably about half that. But we actually have a clinic for post-acute COVID syndrome, and not everybody who has it are people who had really serious illness in the hospital also. And how to exactly manage it is going to be dependent on what kind of symptoms remain, whether it's all breathing issues or whether there are other things that have to be addressed. So MIS-C, relatively uncommon, long COVID, not uncommon at all.
All right, we have another Delta variant question. Has the distance changed for spacing with the Delta mutant?
Our focus has been on the vaccination, so we are not emphasizing the social distancing or physical distancing right now.
Yeah, I would though point out, so I agree with that, and secondarily, we're talking about masking, but these are still droplets, so there may be more of them, but they're still droplets, so 6 feet should still be effective as long as you're in an area that has some ventilation in the room. If there's no ventilation, all bets are off, and 6 feet is probably not far enough.
All right, so are private groups that are open to public members, such as Al-Anon or Alcoholics Anonymous, subject to CDPH masking guideline options, such as honor system, vaccination status verification, or universal masks required?
If they are not verifying vaccination, then especially if they're meeting indoors, our advice is that they go ahead and use a mask.
All right.
That is.
And this next question comes from Hannah. She asks, my friend Megan told me that certain beverages can cause false positives in rapid tests. Is this true?
You know, it probably is. It depends on what the rapid test is. So, so one of the rapid antigen tests uses a methodology called lateral flow, which for women who have done pregnancy tests, they know what they are. For men who have actually seen women do pregnancy tests, they do as well. So it's basically a piece of plastic, but there's a piece of filter paper in the plastic that ends up that there are lines that come up when things are positive. And so some acidic beverages, which include most of the like Coke and Pepsi, have really low pHs. It's really acid. That stuff can sometimes click those tests. So the way that we would suggest people do antigen tests is do it in the morning before you eat, or at least abstain for a couple hours before you do your testing.
All right, thank you for that. And one final question, Kathy asks about the clinical trial you were referring to earlier, Dr. Cohen, about, I believe this is in reference to the one about hesitancy amongst young people.
Yeah.
How can young people obtain information about that clinical trial?
Yeah. You know what? What I'm going to do is, I think it's already up on our website somewhere, but if I'll try to pass the information back to the folks at the county, and they can pass it on to you. But I think there's a place on a website that you can get in.
All right, and that does it for our questions. Just one last message from Kathy again, just thanking you all for your dedication and saying you're very much appreciated. So with that, I would like to thank everyone for participating and submitting your questions. Also would like to thank all of our interpreters, Ahmed, Laure, Michael, Alexander, Maricela, Miguel, Tam, Cindy, and Jordan. And then thank you again to Dr. Kasirye and Dr. Cohen for your time and your expertise. Thank you so much, everyone. Have a great night.
Okay. Have a good
Thank
evening,
you all.
everyone.
Take care.